WDAE. Catch the Rays all season on the Rays Radio Network. For tickets, visit RaysBaseball.com. Who's banged up? Who's in the training room? It's time for the Dr. Lox Sports Injury Report. In pain, don't operate, rejuvenate. DrLox.com.
And we're happy to have in studio for his first visit, which is going to be a long-time relationship, I'm sure. Dr. Dennis Lox joins us now from the Lox Sports and Regenerative Medicine to talk about what's going on with a lot of injuries through sports that we read about all the time. Dr. Lox, great to have you, first of all. Thanks for joining us this morning. Right here in Tampa Bay, I don't think there's a team in sport that has more guys on a disabled list. It looks like a veritable, fantasy team, if you will. They got 11 or 12 guys on the disabled list. The most recent, of course, is their reliever, left-handed reliever, Jeff Beliveau. He has a torn labrum. And anytime, even though this guy is renowned for what he does, anytime they send you to Dr. James Andrews, it's usually not a good thing as far as your career goes, but he'll get you back on the field. And James Andrews, you know, probably very well. So torn labrum. This is the end of his season. What kind of a return rehab is he looking at right now?
Well, that's a very excellent question, and if you make it to Dr. Andrews, it's a positive thing because you have to be a good prospect in order to make it.
That's a good point.
To actually see Dr. Andrews.
That's a good point.
A labrum tear, I believe he started out with a tentative diagnosis of impingement syndrome, which is more rotator cuff. But the labrum is actually the cartilage that lines the inside of the socket joint. But when it tears, it's the equivalent to football's ACL injury, and it is a devastating injury. And studies have looked at that, and they're not very favorable. 69% return to pitching and within 1 year, and only 29% are still pitching at 3 years.
Wow.
Relievers will actually do a little better than starters, and that's because they have to pitch less innings.
The workload, yeah.
But the overall effect, even if you make it back, is their performance declines. They don't have the velocity and also the stamina, so the relievers will do a little better because they don't have to pitch as many innings.
This is a young guy, so does age matter in this situation?
Yeah, age does, and it actually happens in pitchers who are closer to 29, and he's 28. So as you age, the more pitches you throw over your career, you're going to fray the labrum, and it just is a repetitive overuse sort of thing. So it's not uncommon that in late 20s you're going to get it, and he's right about that age.
Yeah, absolutely. Also, I don't know if you had a chance to see this last night, but Steven Souza Jr. Was batting, and he actually struck out, and in swinging the bat, he kind of, after he finished the swing, grabbed his arm. Looked like he grabbed his hand at first, or his wrist, or that area, but then it turned out to be some sort of a forearm cramp. What might cause? They don't think it's serious. So what might cause something like that during the course of playing and swinging the bat?
Well, several things, and obviously whether he got hit, and it did not appear that he got hit,
no.
But you can cramp up the flexor tendons, or if it's on the inside of the forearm, or the extensor tendons if it's on the outside. And sometimes you can actually have a tear in some of the muscle fibers, so it'll ball up very tightly and look like a big knot. But the fact that they think he's already on the mend implies that it's not a serious incident.
So is this something that would just require some rest, a few days off perhaps, or would they?
If it's not a completely torn tendon, a classic example would be a bicep tear where the whole tendon tears and the muscle actually drops and you get this big knot.
Yeah.
Well, that's a very significant thing.
Right. Doesn't appear that that's what it was. Jose Baptista, the Toronto Blue Jays slugger, one day after hitting a home run, which he took about a half hour to get around the bases, he reported that he has a strained right shoulder that had been aggravated in that game. So, Baptista, a power hitter, takes enormous swings. This is a guy who swings probably as hard as anybody in the game. So what might he be looking at as far as his shoulder goes?
Well, it's problematic in that a shoulder strain is a very nebulous diagnosis. It could be anything. A strain implies it's muscular in origin, where a sprain, you're dealing with a ligament or a tendon or muscle. The fact that he's now day-to-day sort of signifies, since they already got an MRI, that it's not a significant injury. So
more of a strain, a tendonitis type thing? Maybe?
Yeah, I think that they may have found nothing or just a tiny little area on an MRI that wasn't considered significant to put him on a day-to-day status. But as far as hitting, it may bother him a little bit, and he actually took a very aggressive throw and had a previously aggravated injury. So, I think that the hoopla around him was that he didn't really need to do that throw when they were up by, I guess, 9 runs at the time.
A number of runs, yeah.
Yeah, so I think that his prognosis, if he doesn't have a serious injury on an MRI, is very good for getting him back quickly.
We're talking to Dr. Dennis Lox of Lox Sports and Regenerative Medicine, and if you need more information, you can visit Dr. Lox at drlox.com. Shea Weber, who's, of course, a big player for the Nashville Predators. It's interesting in hockey, and we face some of this in football where they're not real specific always about injuries, but in hockey, probably the least of all. Lower body injury. You work with sports teams all the time, and particularly in the NHL, so what are we can't draw anything from that, right?
No, I find it an interesting thing about hockey in that it's a very nebulous diagnosis, synonymous to saying when a patient comes in, I got back pain. It doesn't really mean much.
Right.
You need a specific diagnosis, and they purposely say it's an upper body or a lower body injury to be vague for many purposes, and I think you have a very good idea of the
one of them might just be because they don't want them to target a specific injury. If you're playing against them, that's one thing that is done in the NFL. In the NFL, I think it's more like the reason we have injury reports and they have to be more specific is because gambling's such a big part of that sport, and that you can affect the line one way or the other. So they can't just say lower body; they have to say knee sprain.
Yeah, and if the rules are such that you can be nebulous, I wouldn't want somebody targeting my injury segment.
That's right, exactly. So we'll see if Shea Weber comes back. But it is interesting how teams are able to sort of just be vague and deliberately so. And I think the NHL does a better job of sort of protecting their guys in terms of, like, I don't think they're as targeted as much. I don't know. But particularly we talked about their stars. You don't see guys going after stars really ever. And then when they do, it's a melee, right? Yeah, exactly.
Yeah.
Well, this has been a great visit. We're going to have you every week. And Dr. Dennis Lox, you want to listen to this injury report, his Lox Sports and Regenerative Medicine. If you want more information, visit Dr. Lox on drlox.com. In pain, don't operate, rejuvenate. drlox.com. Thanks, Dennis. Appreciate
welcome.
it. Lox, by the way, it's LOX, Dr. Lox, LOX.com.